Thank you, Honourable Speaker. I thank you for this opportunity to again deliver a ministerial statement on something that I believe is very important and something that we as a nation should be very proud of. Honourable Speaker, I rise before this House to give a brief on one of the new initiatives of the Fijian government, this government, the Fiji Emergency Medical Assistance Team, or FEMAT. Honourable Speaker, sir, FEMAT comprises of a group of health professionals that have been highly trained and equipped to provide services to a population affected by an emergency or natural disaster. When storms strike and inflict life-threatening injuries on our people, we need to get these affected Fijians the urgent care they need as soon as humanly possible. Honourable Speaker, sometimes making the journey to a health centre, especially in rural and maritime regions, can be painful, difficult, or even impossible. That's where FEMAT comes in, a specialized team of medical professionals who can go directly into affected communities and provide services that saves lives in times of disaster. In summary, it is like a special forces of the Minister of Health, so as to speak. Honourable Speaker, the concept of an emergency medical team has been around in the Ministry of Health for a long time. We have been part and parcel of NDMO work, including medical officers embedded into teams that go out into the communities after cyclones and other natural disasters. But during this period and during those times, we've realized that there's only limited amount of work that we can do. And often it's because either we didn't have the resources or our people were not trained in how to look after Fijians and those who may be affected after the disaster. Following Tropical Cyclone Winston, as we all know, in 2016, the Ministry of Health and Medical Services participated in a conference on EMT in Japan, or emergency medical teams in Japan. We knew before that and after that, after the cyclone, that training needed to be done for Fiji because Fiji was going to be experiencing similar or graver threats with climate change, and we knew something had to be done. Therefore, Honourable Speaker, we laid the groundwork in partnership with the World Health Organization, WHO and OSMET to build Fiji's capacity as a regional hub for disaster response. Honourable Speaker, as I've alluded to earlier, we weren't starting from scratch. There's, as I said, there's been some work done from previous cyclones from before, but more importantly, our peacekeeping missions, we've had deployment from the Minister of Health in a very significant way. Before, there used to be a doctor, maybe a nurse, maybe a pharmacist, and also a health inspector. And you, Honourable Speaker, being a former commander, would have attested to this. But it was in 2013 in Syria that we began to then really send teams on a significant amount that were being deployed to Syria. And again in 2015, our first regional international humanitarian assistance disaster response was to Vanuatu after Tropical Cyclone Pam. And this began to highlight the caliber of our staff and our capabilities. Honourable Speaker, at one stage over the last few years, we actually ran the United Nations hospital in Syria. And to do that, we had to have a complement of nearly 20 Ministry of Health staff embedded into the Royal Fiji Military Forces. This included qualified surgeons, anaesthetists, those for a health inspector, pharmacist, dentist, so as to speak. Honourable Speaker, Fiji's local response during Tropical Cyclone Winston in 2016 again indicated our level of experience and exposure in disaster response. We did relatively quite well. However, we saw the value of ensuring our disaster response teams have to be fully internationally accredited through a WHO EMT verification process. So essentially, Honourable Speaker, if a country had an emergency medical team that wasn't accredited, because every nation is sovereign, it could possibly react within its own borders, but outside of its borders, it wasn't certified to do so. And that's why we wanted to be sure that we had WHO verification for both inside and the capability to assist other Pacific Island nation states if the need had to, or even beyond that because of WHO verification. So the WHO EMT, or Emergency Medical Team Secretariat's verification and accreditation system would ensure that our EMTs are quality assured and wholly self-sufficient when responding to disasters. But this team is not only dedicated, as I've alluded to treating only Fijians in the wake of catastrophe. They provide a range of services for Fijians in our rural and maritime regions who have traditionally been beyond the reach of specialized medical services. Honourable Speaker, sir, we are grateful for the support of our development partners, but let's be clear, FEMAT is a government initiative. The team works closely with the National Disaster Management Office. We've received funding from WHO and MFAT for workshops. Additionally, the initial logistics supply, including the tents, was supported by the Australian government. But the vast majority of funds which helped in the setup of the team and the continuous payment of the team until now comes from the Minister of Health and Medical Services with appropriation from the Fijian government. Honourable Speaker, I'm proud to say that our FEMAT team is a WHO verification international Type 1 fixed EMT, which can provide responses and services equivalent to at least a health center in Fiji and can also assist other countries in the region when needed. Honourable Speaker, Fiji is the first developing country, the first small island state, and the first country in the Pacific to have an international EMT. In fact, Honourable Speaker, we are the 9th country in the world to have done so. With FEMAT, the Minister of Health and Medical Services now has a world-class disaster response system that can assist with organizing and managing the National Health Emergency Operations Center. FEMAT brings with it a high level of standard of care, practice and response mechanism that is timely, well coordinated so that the Ministry is ready 24/7 to answer any call for disaster assistance and deployment. And Honourable Speaker, up till now we have 350 of our Ministry of Health staff that have been trained in FEMAT. Some of them were trained in Australia, but majority of them were trained here locally. And they are all over the country. So if there is a need, we can, for example, have a team ready in the north or in the west, or ready in Suva, because they are all over the country. And we continue with our training. We want to get as many as possible through our training programs. Honourable Speaker, FEMAT was internationally verified on the 11th of May 2019. Since its verification, FEMAT has been actively involved in surgical outreaches across the country. Under the principle of the WHO Universal Health Coverage, which is also a pillar of development and strategic priority for this government, the Ministry of Health and Medical Services has started the decentralization of its specialized services to ensure that we reach the unreached and that no one is left behind. We're a nation of nearly 130 populated islands. We face challenges unique to our geography and to our people. That demands we be innovative and seek new ways to bring Fijians the high quality services they deserve. Last year, Honourable Speaker, we successfully deployed FEMAT surgical operations to Korbo, Singotoka, and Bunindao Hospital, and a maritime deployment to Kandavu with the support of the marine vessel Ifereimi Fiji's hospital ship, which has a surgical capability. In the FEMAT community visits, with the use of specialized FEMAT tents, the team operated on 84 individuals in Korbo Telebu last year, 50 in Singotoka, and 52 in Bunindao. FEMAT was involved in the planning and testing of surgical facilities in the marine vessel Ifereimi while berthed at the GSS wharf to test the system prior to the ship's first deployment in the maritime region. So far, the MV Ifereimi, with FEMAT, has conducted surgical outreach in Lau and Kandavu and was used by the Lotoka Hospital in December 2019 for 2 weeks while berthed at the Lotoka wharf, and has just completed the week-long outreach visits, two week-long outreach visits to the Northern Division. Honourable Speaker, after tropical cyclone Sarai, the FEMAT team conducted the outreach visit to Kandavu and delivered the following health services: 60 community assessments, 120 wash kits delivered, 154 clinical consultations, 47 surgical operations, 5 medical evacuations to CWM Hospital, 34 family health consults and dignity kits, 38 psychological assessments and counseling, 10 health facility assessments, 25 dietetics and nutrition counseling, 24 food business organization inspections, 60 vector surveillance inspections, 832 cakes of soap distributed, and 125 water purification system distributed. Then the FEMAT team followed up with a visit to the number of islands in the Southern Lao group and provided the following health services for the people: 591 clinical consultations, 3 operations, 2 medical evacuations, 37 community assessments and wash initiatives, 15 health facility assessments, 212 wash kits delivered, 1,060 cakes of soap delivered, 2,120 purification tablet distributions, 98 family health consultations, 193 psychological assessments. This is after the cyclone, Honorable Speaker. 260 dignity kits distributed. While berthed at the Lotoko Wharf for 2 weeks, the team completed 373 operations. At the JSS Wharf in Suva, for 5 days they did 52 operations. Honorable Speaker, 2 FEMAT missions were undertaken in the Northern Division, a maritime mission and a mainland mission, and I was fortunate to be part of both. In these 2 visits, the following health services were delivered to the people of the Northern Division: 75 community assessments, 45 wash kits delivered, 1,098 clinical consultations, 121 surgical operations, 51 ONG consultations, 209 eye procedures, 72 pediatric consults, 2 psychological assessments, 238 dental consultations, including 118 dental extractions and treatments, 8 health facility assessments, 162 dietetics and nutrition counseling, 18 physiotherapy consultations, 33 food business organization inspections, and 50 vector surveillance inspections. Honorable Speaker, there was an island that we went to in the Northern Maritime when there was a lady who had suffered from a stroke and was being looked after by the husband. They were the only couple in their house for the last 2 years. And our physiotherapist, together with our doctors and nurses, went and visited them. And throughout the day that we were there, I taught the lady how to walk and showed her some simple exercises. That afternoon, as we were passing by the village in her house to go, she was standing, assisted on the doorstep, waving to us and thanking our staff for teaching her how to walk in her own home, in her own island. Honorable Speaker, these deployments have brought relief to countless families across Fiji, saving people time, money, and more life-threatening complications, and mitigating the risk of the spread of communicable diseases. Honorable Speaker, FEMAT has numerous benefits. 1, it has shown the world that Fiji is capable of achieving world-class service delivery, and we've cemented our position as the hub of disaster response in the Pacific. May I remind this Honorable House that we were the 9th country in the world. 2, during Tropical Cyclone Sarai, FEMAT conducted its first domestic deployment to Kandau, where the 2 systems were tested: land-based medical team and a maritime team on the marine vessel Vebuiti. The people of Fiji can be assured that in times of an emergency or disaster, the Ministry of Health and Medical Services now has the capacity to ensure that no one is indeed left behind. 3, more people in Fiji are being reached closer to their homes, villages, and settlements by the FEMAT team, so they don't have to spend money traveling long distances to obtain medical services. FEMAT has also started to reduce the Ministry of Health's medical evacuation expenditure by performing the needed operations in the rural communities and maritime regions. 4, thanks to FEMAT's timely and well-coordinated responses, the Ministry is on the ground quickly after a natural disaster, combating the emergence of communicable diseases such as leptospirosis, typhoid, and dengue fever. Honorable Speaker, sir, FEMAT is not a first responder in a disaster. They are activated as soon as the needs of the community are determined. FEMAT is also available to respond in any disease outbreak. It ran the headquarters Emergency Operations Center for the measles outbreak, and its team and mobile facility is on standby should its capability be needed to deal with any other serious outbreak situations, such as the coronavirus. Honourable Speaker, sir, the Fiji government, through the Fiji Emergency Medical Assistance Team, FEMAT, continues to reinforce Fiji's position as a pioneer and leader in health and development across our region. I thank you, Honourable Speaker.
Thank you, Honourable Minister.